Good morning, everybody. Honorable Health Minister, Dr. Frank Anthony, Honorable colleague from PAHO, my colleagues from the embassy, and my dear friends from the media, and of course, our dear friend from the Ministry of Health. As they say today, we have just signed the completion certificate for the handover of the $1 million grant from the Government of India to the government of the Cooperative Republic of Guyana to combat COVID as part of our worldwide efforts to assist our friendly countries. And I'm very happy that this project was completed in a short duration of time, from the time of announcing it in June till the completion in December. And I must thank PAHO and the government of Guyana for having facilitated the fast movement of all the equipment and also for ensuring that these equipments have been reaching out to the hospitals, especially the Minister of Health and the Honorable Minister himself. I think the team led by him have done a commendable job in ensuring that these materials are indeed reaching out to various regions. And I was discussing with him, especially on the ventilators front, because when this project was taken up, I think Guyana had less than about 10 ventilators functioning, for about 4. So, which is actually, for a country of 800,000, really doesn't work much. So I think this donation of over 35 ventilators has really enabled them to spread the safety net, if I may say so, across all the regions. And we are very happy that India could be a partner in this project for Guyana. And as you all know, and also my dear colleague from PAHO was mentioning, India has always been like the pharmacy of the world. And we believe that we have a lot to cooperate in the future. And on this occasion, we just have been informed by my government that we will be getting the vaccines to Guyana on the 8th of March. It will be a donation by the government of India, initial donation of about 80,000 vaccines, and which will be used by the government of Guyana. This will be the same Serum Institute produced AstraZeneca Oxford vaccine, which has been approved by WHO. But before the WHO approved, we had also got the approval of the Honorable Government of Guyana for emergency use. But now, since the WHO has approved it across the world, I think you don't have to use that emergency authorization anymore. You would all recall, colleagues, that Barbados had sent 3,000 vaccines from its quota, which was actually sent by India again. Out of the 100,000 sent to Barbados, then sent 3,000 across to Guyana. But now Guyana will have its own 80,000, and we are working for further collaboration. In case Guyana wants more on the commercial basis, we will facilitate that with the Serum Institute. And Serum Institute in particular, as my colleague was mentioning, it is indeed a giant. In fact, before COVID also, Serum actually provided close to about 45% of the world's vaccines. 45%. And this was a very less known fact. But thanks to COVID, now it's coming out. They were always below the radar, as they say. Thanks to the quality and also to the pricing, WHO vaccines almost always are sourced from this particular Serum Institute, be it your polio, your hepatitis, your DPT vaccines, anything that is sent out to the poor countries and to the developing countries across the world is made by this Serum Institute. And the current production of this, what we call the Covishield vaccine, its product name is Covishield, but it's the AstraZeneca Oxford vaccine. It is about 650 million doses will be produced by July, August of this year. But India is actually, not only using it for its own frontline workers. We have started a process of vaccinating our frontline workers from 16th of January, and we have completed over, I think, about 12 million workers already. We have a goal of inoculating about 30 million frontline workers by end of March, in the first phase, if we say so. And after that, we plan to open it up. This is strictly being done in the government centers, but now we plan to open it up at the private hospitals also, because in a country of 1.4 billion, you can't really reach out to everybody if you regulate the places where you want to inoculate them. And at the same time, we are also actively working on donations across the world. So far, we have donated more than 8 million vaccines across the world, and we have about 90 countries. We have donated already to over 30 countries. Another 90 countries are in the queue. We are, working very closely with all those governments. In fact, India has committed to the COVAX facility. In fact, the vaccines which come from COVAX will again come from the same Serum Institute. So COVAX in turn is then distributing it to many countries across the world, the Gavi COVAX initiative. And India has committed to give about 10 million vaccines to Africa, out of which the first batch of 600,000 were airlifted day before yesterday. And India has also committed about 1 million vaccines, 200,000 vaccines to the UN health workers. So the United Nations will also benefit from the Indian donations. And we are currently also working on a 500,000 vaccine donation to the various CARICOM countries. So out of which Suriname is getting 50,000, the Antigua and Barbuda will get 40,000, St. Kitts and Nevis will get 20,000, and it goes on. So these are all donations, but we also want to work very closely with the government of Guyana to enable them to inoculate the population and make Guyana a COVID-safe country. And as usual, I would like to reiterate my government support to all the actions taken by the government of Guyana to combat the COVID pandemic. And we stand prepared to face the pandemic. And as you all know, Prime Minister Modi, way back last March and April itself, he had given a call for multilateral collaboration on facing this pandemic, which I think has made it more than relevant now that we all can survive this only by collaboration. Individualistic approaches will not work, and unlike many other countries which the media keeps on telling that they are hoarding the vaccines, but India is not doing that. We believe in sharing. We believe that world is one family. There is a saying in India called Vasudhaiva Kutumbakam, means the world is all one family. So we believe in vaccine Maitri. Maitri means friendship. So vaccine friendship is our goal. Although my media friends in India and abroad, they dub it as vaccine diplomacy. But please, I want to clarify here, it's just friendship, no diplomacy here. We want to emphasize that we don't send things as donations with any hidden agendas. We don't ask for any quid pro quos. It's just a straightforward donation. We believe in our friendship. We believe in our strategic partnership. And we believe in our friends like Guyana.
It is indeed a wonderful morning. As we bring one project to an end with India, and that is the $1 million or so donation, that has made a tremendous impact in our response to COVID. And as you rightly pointed out, High Commissioner, with that money, through PAHO, we were able to buy 35 ventilators. We were also able to buy oxygen concentrators. We were also able to get needed PPEs at the time, because without masks, without gongs and so forth, it would have been very, very difficult for our frontline workers to actually do their jobs. And with this donation, it really made a big difference in the way that we were able to respond to COVID at all levels of our system. At the regional level, where we didn't have the capacity to be able to ventilate patients, and at the national level, because most of the ventilators that are currently in use at the Ocean View facility are really from the donation that India has provided. So indeed, this particular project has made a huge impact in the way that we respond to COVID here in Guyana. And on behalf of the government of Guyana, we would really like to thank the government of India, the people of India, for this kind gesture, which has been so impactful in our response. And we hope, High Commissioner, and we know that you will be able to convey that to the Prime Minister and the other government officials in India, that we really, really appreciate all that has been done for us. And to PAHO WHO, I think they have been a really steadfast partner through all of this, because they have been able to administer this grant in a most efficient manner. And when things on the global market was very difficult to access, they've been able to use their network to be able to leverage very, very scarce item and to get it to us in a timely manner so that we can mount this response against COVID. So to Dr. Codina and your team, we want to extend our gratitude, and we continue to collaborate with you as we continue to fight this pandemic. High Commissioner, indeed, as we close this grant, you have really brought excellent news this morning, because the next step on the way that all the experts believe that we can exit this pandemic is that we have to get vaccines. And vaccines, once we use them and immunize people, it would help us to confer herd immunity in our population. And once we can develop herd immunity, it means that we can be COVID-free, as you put it. And that is going to be a big task, because right now there's such a scramble for vaccine globally. And while COVAX has been trying desperately to coordinate the global effort for most countries, they have been at the global level various levels, I would say, of selfishness, which has put the whole facility sometimes in jeopardy. But among all this chaos, what we have seen is shining lights like India that has stepped forward. We know that you have your own needs. You have quite a large population. And despite the needs that you have internally, you have decided to share with the rest of the world the vaccines that you have. And, we in the Caribbean, we are very grateful for the kind donation, the allocation that you have given to the Caribbean. And we in Guyana, the government of Guyana, we are extremely grateful that India is going to donate to us 80,000 doses, and that we're going to get those doses by the 8th of March. And what a beautiful day, because that would be International Women's Day, when we celebrate International Women's Day, so that we are going to be getting so many doses. As you know, High Commissioner, we have been planning for vaccines in Guyana for some time now. We have developed a vaccine deployment plan. We have looked at our cold chain. We have bolstered that cold chain. We are right now finishing off 14 facilities that we have in different parts of Guyana to be able to store vaccines in the various regions and to roll out vaccines from those regions. And we have used the occasion to train 35 different teams of people to be able to roll out the vaccines. And so we are ready, and we are confident that at least on a daily basis, we can actually do about 7,000 immunization. That's how we have designed the system. And if we need to do more, we can scale it up to do more. So we are extremely elated this morning, to say the least, that these vaccines are going to be coming in, and that we can start that journey to immunize our population, which would take us one step closer for us to start ending this pandemic in Guyana. And it's all thanks to your government who has made this possible. So thank you very much, High Commissioner.
You're welcome.